said that you got LASIK done. I was planning to get it done myself. So, firstly, will it be a safe thing? And also, what's the procedure after the operation? Like, how many days you have to stay away from the screen, stuff like that.
So, okay. So, what's your number, by the way?
I haven't checked it, but it's pretty not good, and
Okay.
I will be checking it soon. But
Okay.
I'm pretty sure I have a number.
So, you're wearing contacts, right?
No, I'm not.
Acha, so you roam around without specs.
Yeah,
Acha, so you might not have that much of a number, no? Can you see the football while playing?
definitely I can. It's just that
Okay.
when I'm looking at a long distance, I'm not able to read.
Hmm.
Like earlier, I used to be able to. Now that's become weak.
Okay, so I think a LASIK vision treatment can be beneficial for you because there is something called as supervision. So LASIK is of a lot of types.
Hmm.
There's femto LASIK, there's normal basic LASIK, there's PRK treatment, there's Contura treatment, there's smile treatment. So all of these are various forms of LASIK. They're all laser surgery, but they're basically different machines from different companies.
Hmm.
So it also depends on your personal preferences and your how your lifestyle is and how your cornea is, even that.
Hmm.
So if you're someone who doesn't indulge in a lot of sport, if once a week for someone like you don't really need to go for a smile treatment, which is generally expensive. It's about 1.5 lakh. So that one creates a very. So what happens in LASIK is that the surgeon will cut off your cornea. They will create a flap. They will remove the flap, and then the laser will do all the work.
Okay.
So it's like a 2 minute treatment. 2 minutes for each eye, and then you're done. That's it. You get in the room. The surgeon just you're already under anesthesia, so you won't feel any pain. And then within 2 minutes you're out, full clear HD vision, and then everything is great. So the flap that is created is big in normal LASIK, but it's just a slit in a smile LASIK. So it depends on person to person and the corneal thickness that you have as to which LASIK you should get. But for that, I think is consulting with the ophthal who will run you through a pre-operation procedure will help you understand which one is the best for you. You'll get the most approved ones. So if you want this clarity in vision, I have done a Contura LASIK.
Okay.
So normal vision is 6 on 6.
Hmm.
Contura LASIK is 6 on 5 vision. So you have something called as a supervision. So let's say someone who has no number, zero number, I will be able to see farther away from even him in terms of clarity because the Contura LASIK improves not just your vision, but it also corrects all the corneal aberrations. So any irregularities on your cornea is treated by the Contura LASIK. So that one is one that you can go for if you want supervision. And then it also depends on which surgical procedure you're going ahead with as per your corneal thickness. So the ophthal will guide you for that. But if you're doing a normal LASIK, I would suggest just go for the Contura one. If you want to go for a sport specific LASIK, then go for the smile one.
And how many days after you're saying you should avoid screens and stuff? What was your
So you're ideally supposed to avoid screens for just 2 days.
okay?
Even one day is fine. Um, but but everything else. So you cannot shower. You cannot take a head bath for a week.
Okay.
So what I did was I just use a hand shower for my lower, like anything below my neck, and then my hair I just wet it by putting it in the under the sink, and my face was just wiped with water on my forehead and my cheeks and everything. So no water from outside inside of your eye. You cannot get a head bath.
Okay.
You cannot play sports for 2 weeks. So
Does that include gym also, or gym you can go?
gym you should ideally avoid for 1 week.
Okay.
Even 2 weeks उसमें भी बोला होता है.
Hmm.
But I started going to the gym in just 4 days
Okay.
because as I said, I cannot not work out.
Hmm.
It's just not practical for me. So you can work out. You don't at the gym. Just don't go too intense because what will happen is that you will increase your intraocular pressure, which is basically pressure inside of your eye, and that delays the healing of the flap. So no gym for at least a week. No sports for at least 2 weeks because that flap can get dislodged as well.
Okay.
So you might have to go another surgery if that happens. So no sports for 2 weeks, no head bath for 1 week, no gym for 1 week, no screen for 1 day because that day anyways you're going to be sleeping the entire day. So that's all right. And drops, big pain. You have to go 40 drops a day for the next month.
The drops you took now, was it that?
Yeah, that
Okay.
the same drops. So you've got a lubricant, you've got one corticosteroid, Elpred, and then you've got one antibacterial, antimicrobial, and you've got one so something called as cyclosporin, which is an immunosuppressant. So you've got these 4 medications. So since the flap is coming out and then it's going back in, the body treats it as a foreign body. So उसके against antibody reaction ना हो, उसके लिए these drops are needed. And you may also have dry eyes, उसके लिए lubricants are needed.
Okay.
And infection ना हो, उसके लिए antimicrobial. So
Yeah.
40 drops a day for 1 month.
But it's a 1 month thing only, so that's fine. And it's giving you a life.
No,
now,
it's actually not a 1 month thing. If you have dry eyes after your LASIK, you have to continue the drops for an entire year. If not a year, if you still have dry eyes after that, you have to do it permanently.
Damn.
But that mostly doesn't happen. Very rare that you have, not very rare, say 30% chance that you might have dry eyes. But dry eyes is fine because that's just one drop.
Yeah.
But other things ka drop, if that gets extended, that's a pain.